Christian hospital is a modern hospital that enters modernization with the aid of information technologies during the process. Patients arriving at the emergency center were independently triaged by the duty nurse using TTAS, Taiwan Triage and Acuity Scale, with this computerized decision support system. The system also links to medical equipments, which allows doctors to read patient vital signs data directly. This system works well to download vital signs directly into an electronic medical record, which effectively eliminates errors in vital signs documentation by nursing staff. The system will authorize EMR access for doctors while patients register at the emergency counter. Doctors can access patient history from the CPOE homepage, which includes patient illness, history of allergy, previous operation and hospitalization, present medication, special patient notes, major infectious diseases, etc. Doctors can input the medical record straight into the system after examining patients and be able to achieve paperless medical order through automatic data transmission of doctor's orders to pharmacy, clinical laboratory, radiation, physical examination room, etc. All patient-related information, such as medical images and lab data report, are immediately integrated and displayed on the system screen. It also provides safety check when doctors enter prescriptions and gives warnings for any medicinal reaction, safe dosage, and allergy reaction. The physician orders would already have been sent to all units while the patient visits each department for examinations. All orders for examination would have been transmitted to related modalities right before the patient finishes identity confirmation and check-in. This will increase patient safety and decrease margin of error. Radiology examination of region and method would be transmitted to the machine and recorded in the image straight after it was taken. All those data are uploaded to PACS through quality control. This allows the radiologist to access the image online in any place that provides secure network access. After reporting to the clinical laboratory, the system will determine and produce barcodes for different test tubes. Every item of examination would have been transmitted to the machine right after the test tubes with drawn blood were placed into the machine. After automatic testing, all laboratory data would be automatically uploaded to the EMR through quality control. Standards can be determined for every test data according to the gender and age of the clients. The system will send automatic short message to doctors if high-risk test data were detected. The doctors must reply to this message, or the system will automatically send another notification if doctors did not reply within the given time frame. Nursing staffs can have a clear grasp of all patient-related information and doctor's advice from the mobile e-nursing card during the emergency observation. Every evaluation chart has been turned into electronic charts, and the system would remind nursing staff to execute their responsibilities. The nursing staffs can finish record-taking work by using the system, which would automatically produce electronic shift charts. When patients are admitted into the hospital, the system will make a summary of patient status for the nursing station. Doctors would book the schedule for operating room reservation when they decide to conduct an operation at outpatient department. Related information would be transmitted to the operating room when operating time was fitted into the calendar. Then, necessary preparation would be conducted by the operating room and admission permit printed. The management of beds occupation for the whole hospital, the waiting status of patients, and single bed requirements can be very clear by using the ADT, Admission Discharge Transfer System. After patient discharge and cleaning, the bed would enter the ready-to-use information into the system. The front counter staff will then start the admission process and the printing of barcode bracelets for inpatients to wear for identification and safety. Patient information would already have been received before they enter the operating room. First, the anesthesiologist would conduct an anesthesia evaluation and enter the results in EMR, and then medical equipment preparation would start in accordance to the operation information. Upon entering the operating room, every supply, time, operation record, and charge would all be entered straight into the computer with no more handwriting. By using the mobile e-nursing cart, the nursing evaluation chart was entered directly when new patients are admitted into the hospital wards. Every evaluation card follows the standard nursing guideline of NANDA, NIC, and NOC. The automatic link established between every item is duplicated in order to decrease the entering time of the nursing staffs, thus increasing the quality of nursing care. The system would issue an immediate reminder of the doctor's advice whenever a new advice has been issued by any doctor in the hospital. Nursing staffs must confirm the new advice and follow the pending list of instructions to execute the doctor's advice. Measurements such as body temperature, blood pressure, and pulse oximetry will be transmitted to the vitals measuring chart to reduce errors keyed in by staffs and increase efficiency. The Bluetooth barcode scanner on the mobile e-nursing cart would be used to scan the patient's bracelet at times when patient identification was needed. In times like medicine distribution, where identification helps to ensure the patient takes the right medicine and the right blood test. The necessary nursing measures and evaluations will also be included on this screen for nursing staff from all shifts to follow nursing care protocols. During shift change, every recorded patient status and condition will integrate automatically. A complete record of shift change would allow nursing staffs to grasp patient condition faster and more accurately. If any abnormality occurs within the test report, an automatic reminder would be issued to the nursing staff. All nursing records are signed electronically to achieve a paperless work environment. Patients can make reservations for follow-ups when they are discharged or make outpatient reservations through the hospital website. When making an outpatient visit, service order would be determined by the drawing of numbered cards. After the card was drawn, wait for your number to be called at the patient rest area. Both patient and room numbers are shown on the electronic display, as well as educational health information for patients to take in new knowledge while they wait. Other than waiting to be served at the front counter, patients can use the automatic registering machine to register. All you need to do is insert your IC card, select a doctor from your previous visit or from doctors available on the day, and confirm to finish registering. It's very fast and painless. Insert the National Health Insurance IC card into the automatic check-in machine after registration to check in, as to avoid disturbing doctors currently seeing another patient by knocking on doors in the patient waiting area. The attending nurse can see the check-in information of the patient promptly on the screen and will call for the number drawn by the patient. On the wall of the examination room, check-in and current patient information are displayed. It can be transmitted to the front counter or on the hospital website for patients to check. Doctors can have a clear grasp on the condition of patients through the CPOE system. All the orders and advices from doctors will be checked through by the system and constructed into reminders or suggestions. The system provided a rich variety of self-setting physicians' orders to speed up data entry and diagnosis of doctors. The Ditto function allows doctors to quickly look up the last advice. Doctors can also easily select from amongst the established templates to save entry time. When encountering unknown conditions, an online literature database can be linked directly for research. There is also a medicine database for inquiry on medicine, and various examination reports and imaging results that can be used for reference. All the costs from outpatient, emergency, hospitalization, examination, doctor's advice, and material have already been counted at the time when it was recorded in the medical record. Patients should go straight to the front counter to pay after finishing in the treatment room. After paying for the fee calculated by the front counter system, the patients can then pick up their medicines. Medicines and prescriptions would already have been transmitted to the pharmacy before patients finish their medical service. The system will send part of the prescription to an automatic medicine packaging machine to make up the prescription. The other part of the prescription will be printed out for dispensing by the pharmacist. When getting medicine, the barcode on the prescription will be scanned. This is to assist the pharmacist to confirm the accuracy of the prescription by displaying patient photo, prescription information, and the appearance of the medicines. All the information system was developed mainly by the hospital's own IT department, and the interface and programming of the outsourced system has been integrated and developed. Every system is linked to the other systems. All systems operate and link together. There are no problems with second entry or out-of-sync information because all the information was shared. All daily accounts go directly into financial affairs to produce an accountant voucher. Daily consumption, such as medicines, was deducted directly from storage. Also, automatic order and related logistic information process occur in accordance to the amount of consumption. The systems are capable of rapid program modification in response to the change of process because all systems are developed in-house. Immediate IT support can be added to existing services. Our IT system does not only serve the operation of our hospital, but has experience in both partial IT system transfer and IT system transfer of the whole hospital. We had once transferred the nursing IT system to Shinlo Hospital and IT system transfer of the whole hospital to Renai Hospital. We have even coordinated with the government to transfer management and IT system in helping locals establish a new national hospital in Burkina Faso, Africa.